Okay, picture this. You're leaving the hospital, that door closes, and such relief, right? You're going home. But then maybe a second later, another thought pops in. Like, what actually happens now? Do I know how to handle these new meds? Who do I even call if something feels wrong? What if going home isn't quite as simple as it sounds? That whole moment, moving from the hospital bed back to your own bed, it's a lot more critical and honestly more complex than we probably think. Okay, so let's unpack this a bit. Today, we're doing a deep dive into something that's really vital for patients, yes, but also for how efficiently healthcare runs. We're talking about effective hospital discharge planning. We're digging into this fascinating research article. It's from BMC Health Services Research back in 2012 by Yam and colleagues. And it gives this really unique look at how experts in Hong Kong worked together, collaborated to build like a solid framework for this whole process. So our mission today, we want to figure out what actually makes a discharge plan work well, how these healthcare pros manage to agree on all the crucial bits, and importantly, why all this detailed planning matters. Not just for the system, but, for you or someone you care about if you ever find yourself making that transition from hospital back home. And when we talk about why it matters, well, the numbers themselves are pretty eye-opening. The research pointed out this statistic from Hong Kong. Apparently, around 40% of hospital readmissions were potentially preventable.
40%. Just think about that.
Yeah. Nearly half the people coming back might not have needed to if things were handled better initially. It really screams urgency, doesn't it, getting that discharge process right?
It absolutely does. And, hospital readmission rates, they aren't just numbers on a page. They're a really powerful sign of how effective the whole healthcare system is and the quality of care patients are getting. When discharge planning is solid, it's a total game changer. Make sure there's that smooth handover, that continuity of care between the hospital and home. It's really about stopping those unnecessary return trips and keeping people healthy where they actually want to be, which is usually at home.
Right. And the study really painted a picture of Hong Kong at that time. Discharge planning was often described as piecemeal, lacking coordination. And they were facing huge challenges because of rapid turnover of large numbers of patients with acute illness.
Hmm.
Now, this study was Hong Kong specific, but those pressures, lots of patients, planning all over the place, are those pretty common things you see in healthcare systems everywhere.
Oh, absolutely. Those issues. Varied practices, lack of coordination between hospitals or even departments. That's pretty universal. It just underscores that this isn't like a unique Hong Kong problem. It's a fundamental challenge in managing patient flow, making sure quality is consistent, and frankly, avoiding extra burdens on patients and the system.
So you can imagine being a patient or maybe a family member caught in that kind of system, the potential for things to fall through the cracks, or just that feeling of not knowing what to do next. It must be huge. This study really does put a spotlight on needing something more structured, systematic, coordinated. It's not just about getting you better, it's about helping you stay better once you leave.
Yeah.
Okay, so this is where it gets really interesting, I think. How on earth do you get a bunch of busy, experienced healthcare professionals, people with their own ways of doing things, strong opinions, to actually agree on something this complex and then implement it consistently? The researchers used a pretty sophisticated method called the Delphi approach.
Yeah, the Delphi method. Think of it like this. You need your top generals to agree on a battle plan, right? But you don't want them all shouting over each other in one room. Delphi is basically a clever way to get experts to reach a consensus without that happening. They give opinions privately, anonymously, then they see a summary of what everyone said, think about it, maybe adjust their view, and repeat. They do this in rounds until hopefully a strong agreement starts to form. It gets past, maybe who has the strongest personality and focuses on the collective wisdom.
Okay.
And the big question it helps tackle is, how do you make sure a plan isn't just good on paper, but actually works in a busy real-world hospital, that it's practical?
Exactly. Practicality seems key. And this study, it was actually just one part of a bigger 3-stage project. This paper zeroes in on stage 2. And that stage was all about pre-testing the framework they were developing to check its applicability and practicability. They really wanted something that could work on the ground.
Mm-hmm. And to do that, they brought together this really diverse group, 24 experienced healthcare pros. You had doctors, nurses, physios, occupational therapists, medical social workers, really the whole team involved in patient care. And this panel, they rated 36 initial statements about discharge planning, covering 5 big themes. For each statement, they looked at 3 things. Was it clear? Was it valid? Like, did it make sense? And crucially, was it applicable? Could you actually do this in a busy hospital?
Right, the applicability. So after that first round, what happened? Did everything just sail through?
Not quite. Actually, only 25 out of the 36 statements hit that 75% agreement target across all three aspects: clarity, validity, and applicability.
Ah, okay. So there was a sticking point.
Definitely. And the main roadblock, it really came down to that applicability issue.
Makes sense. What kind of things were they flagging?
They pointed out some very real-world constraints. Things like lack of manpower, skills, and time, especially, on weekends or holidays. That made it tough to do all the needed assessments and planning within that ambitious 24-hour window after admission. And there were also practical problems around getting transport sorted or necessary equipment delivered to patients quickly enough, stuff like that.
Yeah, the nitty-gritty logistics.
Exactly. It really shows that gap, doesn't it,
Mm.
between the ideal policy and what's actually feasible day to day.
So how did the Delphi process handle that? Did they just scrap the tricky statements?
No, and that's the beauty of the iterative process. They took that feedback seriously and revised the wording to allow for greater flexibility. So, for example, instead of saying a care plan had to be performed within 24 hours, they changed it to initiated, which gives a bit more breathing room, right? It means you start the process, even if it's not fully done.
Oh, that sounds more realistic.
Yeah. And similarly, insured equipment delivery became facilitated. Acknowledging the hospital helps arrange it, but can't always guarantee instant delivery. And booked at least 24H for transport became the more flexible, timely transport arrangement. Small tweaks in wording, but they made a big difference in making it feel achievable.
That's clever. Refining based on the real-world feedback.
But there was something else, too, something quite significant. The experts actually felt a whole piece was missing. They flat out said there was no statement in clarifying the role of the members of the healthcare professional teams.
Wow, okay, so they added something completely new.
They did. Based on that feedback, a new statement was added. The role and responsibility of different healthcare professionals for the different tasks in the discharge planning process should be clarified. And that's huge, isn't it? It shows how vital that collaborative input is. It's not just about tasks, it's about who does what, making sure the team works smoothly and nothing gets dropped.
Absolutely. So after all that back and forth, the revisions, adding the new statement, did they finally get there?
Yes. After 2 rounds of rating and discussion, all 36 original statements, plus the new one about roles, achieved that consensus target. The framework was validated.
Nice. It really demonstrates the power of that structured, iterative approach, doesn't it? Taking expert knowledge and refining it against practical reality. So, okay, consensus reached. They've hammered out the real-world kinks. Now, the big question, what does this framework actually mean for someone leaving the hospital? What are the key pieces, the safety nets? These experts agreed were essential. Let's maybe walk through the 5 core themes they identified.
Sounds good. So theme 1 was initial screening and assessment, the big idea here. Screening for discharge needs has to happen early, like within 24 hours after admission. This quick check helps figure out right away who needs simple discharge planning versus who needs the more complex team-based approach. It's about being proactive, not reactive.
And they had a tool already, right? Something called Heartbeat.
They did. The Hospital Admissions Risk Reduction Program for the Elderly, developed by the Hong Kong Hospital Authority. And it was a decent start, focusing mainly on medical risk factors.
Right.
But the experts felt it missed some crucial things, like it didn't really capture the patient's functional status, how they manage daily activities or their cognitive state or mobility, and that info wasn't easily available in the electronic systems then.
Ah, okay. The stuff that really determines if someone can cope at home.
Exactly. Those are often the make-or-break factors for whether someone thrives after discharge or ends up right back in the hospital.
So what did they suggest instead, or in addition?
They proposed adding 7 extra items to that initial assessment, things that give a much rounder picture, like looking at social support, care support available, any changes in their ability to do daily tasks, activities of daily living, or ADLs, their walking ability, history of falls, mental state, and their medications.
Right. Much more holistic. It acknowledges that the patient's life outside the hospital is just as important as their medical chart.
Then theme 2, the discharge planning process itself. Again, the emphasis is on starting early care plans should be initiated within 24 hours after admission. Remember, initiated, not necessarily completed. And the framework stresses that assessments need to cover 4 key areas: medical health, physical function, psychological state, and social functioning. A really comprehensive view.
Getting the whole picture.
Precisely. And importantly, it also called out the need for effective and accessible IT systems. Why? for accurate, timely communication of all this assessment and planning info across different teams and settings. Technology is a connector, basically, to stop information getting lost.
Okay, that makes sense. Moving on to theme 3. Coordination of discharge. This feels critical. How do they ensure everything actually comes together? Who's in charge?
Yeah, coordination is vital. The framework states a designated person could be a doctor, nurse, or an allied health professional should be notionally responsible. Basically, someone has oversight to make sure all the pieces are addressed.
One joint person.
Sort of, yeah. But just as important, remember that new statement they added about clarifying the role and responsibility of different healthcare professionals. That's key here, too. It's not just one person's job. The whole team needs to know their part for it to work efficiently.
Right, the team aspect. What else under coordination?
Establishing formal ways to transfer information to community services, ensuring that continuity of care when someone leaves the hospital, and also practical support, making sure essential community equipment, things like walking aids, wheelchairs, maybe safety alarms, is facilitated before the patient actually leaves, getting them the tools they need, essentially.
Okay, theme 4. Implementation of discharge. This sounds like where the rubber meets the road, actually getting the patient ready and out the door safely.
Exactly.
Yeah.
And a huge part of this is patient empowerment. The framework insists that patients and/or their carers must be engaged in the preparation. They need to be given appropriate information on their illness, understand the danger signals to watch for. It's not just dumping information, it's actively involving them so they feel confident managing things at home.
That feels so important. What about the actual paperwork, the information they take with them?
There's a requirement for a specifically designed patient discharge summary. It has to include the diagnosis, any follow-up plans, medication details, instructions for other services, and crucially, it needs to be given upon discharge, right then and there. No delays. Immediate, actionable info.
Got it. And logistics.
Yep, covered too. Timely transport arrangement should be made if necessary. And also, using a patient checklist before they leave, just to double-check understanding of everything.
Okay, one theme left. Theme 5. Post-discharge follow-up. What does that cover?
This really emphasizes that the connection doesn't just stop at the hospital door. It highlights the need for continuous communication, maybe verbal communication via telephone or written information between different healthcare professionals, especially when a patient is transferred, say, from an acute ward to a rehab facility or referred to a community program. It's about making sure that handover is smooth, so patients don't fall through the cracks just because they moved location.
Wow. When you lay it all out like that, you can really see the level of detail. It feels like a genuine safety net they were trying to build, going way beyond just the clinical stuff to cover the social side, the logistics, empowering the patient, all of it.
Exactly.
Imagine the peace of mind, knowing all those things were being considered for your discharge, from your health to your right home, basically.
And that's really the goal. This consensus framework, it gives policymakers and hospital managers a solid reference point. It helps them set up discharge planning that really aims for that smooth patient transition from the hospital to the community, and ultimately improve patient outcomes, clinical outcomes, and social ones. It directly tackles that problem of preventable readmissions by making the process more systematic and reliable.
And it's important to remember, this wasn't the absolute end of the research project, was it?
No, that's right. The paper mentions that the next step, stage 3, was actually applying this framework, piloting it in a real hospital setting. They wanted to test its feasibility, applicability, and impact, and also check satisfaction from staff and patients, which shows that commitment to making sure it doesn't just look good on paper, but actually works in practice for everyone involved.
What an incredibly detailed deep dive that was. We've really gone from seeing the problem, those avoidable readmissions, all the way through to this meticulously built, expert-driven framework for discharge. It's a fantastic example of how, thoughtful research and genuine teamwork can actually lead to real improvements in how healthcare is delivered.
Absolutely. And while, yes, this was developed in Hong Kong, the core ideas, early screening, teamwork across disciplines, clear communication, empowering patients and families, those are universal principles. It really highlights just how much careful thought, collaboration, and importantly, real-world testing it takes to make these transitions hospital to home truly effective and safe, reducing the strain on everyone involved.
So, what do we take away from all this? Maybe consider this thought. If getting hospital discharge right is this complex, needing this level of expert agreement and practical testing, what other parts of healthcare, things that maybe seem routine on the surface, might actually be struggling with similar hidden complexities? What could potentially change if every step of your healthcare journey received this same kind of deep, collaborative, and thoroughly planned approach. Makes you think, doesn't it? Well, thank you for joining us on this deep dive today. We really hope it's given you a fresh appreciation for all the intricate planning that ideally goes into a smooth transition from hospital to home, and maybe, just maybe, sparked a bit of curiosity about how we can keep making our healthcare systems even better.